Hello, this is Dr. Eric Bricker, Medical Director for SimplePay Health, and today I'd like to speak with you about how SimplePay assesses doctor, hospital, and medical facility quality and cost. So, SimplePay uses 4 levels to assess quality and cost, and I'm going to go through each one of those 4 levels now. So level 1 has to do with assessing the doctor, where we review their board certification, and then we also look at their outcomes as they relate to their mortality rates, their readmission rates, their hospitalization rates, and their complication rates. Now, SimplePay risk adjusts the measurement of those outcomes. And that's important because some doctors just happen to see a lot more sicker patients than other doctors. And so we shouldn't penalize those doctors for seeing sicker patients. But if you do risk adjustment, then that allows you to make a better apples to apples comparison on their outcomes. Okay. Next, especially for primary care physicians, we assess gaps in care. And a gap in care is where a doctor needs to do a screening, let's say for breast cancer, or a screening for depression, or a screening for hypertension, and making sure that the primary care physicians are performing the screenings that they should be. And then it's not just for screening, but it's also for treatments as well. To, let's say for a person with diabetes, if they have elevated high blood sugar, that the primary care physician is actually addressing that high blood sugar, whether it be by prescribing them a medication, or increasing the frequency, or increasing the dose of the medication. Okay. We also look at the residency location of the physicians and if they've had any malpractice suits in their past. Okay. Now, we take all those quality scores and we put the physicians into percentiles compared to their peers. So there's like the top 10 percentile, and then there's the next 10 highest percentile, and then the next 10 highest percentile. And so in that way, the physicians are essentially benchmarked against their peers. Now, level 2 is similar, except it's for the hospitals and the medical facilities, where we'll assess the hospital by the specific clinical department, specifically like the cardiology department, or the OBGYN department, or the surgery department, where we'll look at things like mortality rates, and hospitalization rates, and readmission rates, and complication rates by department. So that, and from our data, we can actually see which doctors are associated with which departments at which hospitals. And so we would want to know, okay, well, who are the really great physicians? And then who are the really great physicians that practice at really great departments within hospitals? Because when you match up those two, that really provides a fantastic experience for our members. Okay. Now, level 3, speaking about patient experience, is specifically about patient experience, because obviously the relationship between the doctor and the patient is hugely important in healthcare. So we get a lot of patient survey data from these things called HCAHPS scores. It's an acronym. It stands for the Hospital Consumer Assessment of Healthcare Providers and Systems. It's a survey that actually goes out to patients after their care, giving them the opportunity to rate their care. So we take that data along with data from other third-party sources, such as vitals and health grades, so that we can get a better sense of the bedside manner and the relationship that physicians can form with their patients. Okay, now the 4th and final level is for cost effectiveness, because there's a high degree of variability in cost among different hospitals. And there are some hospitals that charge 2, 3, 5, even 10 times more than other hospitals in their area for the exact same service. And there's like no justification for that. So we want to make our members aware of that as well. And that's the 4th level. Now, all of this comes from data literally from 130 million different patient experiences. It's literally over 30 billion claims that we have analyzed in order to bring this data available to our members. And so I wanted to share with you today how SimplePay Health addresses doctor, hospital, and medical facility quality and cost. Thank you so much for watching.